In this video, we will look at key elements of study design through two examples. The first is a clinical intervention study, the bee sting study that we introduced in the video on healthcare planning. This is an example of an experimental study. The second study is an example of an observational study, looking at hospital length of stay for uncomplicated deliveries. A study is based on one or more research questions. From the research question, you can identify the outcome and treatment or exposure of interest to the investigator. The research question will also specify or imply the population to be studied. This population may be defined naturally, such as mothers giving birth, or may be restricted based on clinical or demographic factors. For example, a study may focus on children, adults, or the elderly. The number of subjects or observations to include in the study and how to enlist them must also be determined. This number is often governed by the resources available for conducting the study and the ease with which subjects can be obtained. For example, there may be a small number of potential subjects having a rare disease in a geographic area. Almost always, our desires with respect to the study objectives are larger than the time or budget available. If the study resources are not adequate to meet the study objectives, then either the study scope must be reduced or the budget increased. Conducting a seriously underfunded study will likely be wasteful of the limited resources and is fiscally irresponsible. In any study, you want to obtain as much high-quality information as you can given the available resources. There are four important considerations that will help achieve these goals: minimizing bias, making sure effects are not confounded, obtaining statistically valid results, and selecting appropriate comparators. Confounding means that the relationship between outcome and exposure is distorted by the presence of a third variable. This third variable has to be associated with the exposure and the outcome, but not on the causal pathway. You want to collect information so that you will have statistically valid results. There are a number of ways to assure this, including having sufficient sample size and randomization if possible. Finally, picking the appropriate comparison or control group is important. You want that group to be representative of the source population to the greatest extent possible. The degree to which you can achieve these goals will depend on the study objectives, treatment or exposure, test subjects, and study resources. The bee sting study is an example of an experimental study. The research question that was posed is: in adults seeking emergency department treatment for bee stings, to what extent does a topical application of heat impact the experience of pain, swelling, and itchiness compared to the topical application of cold? There were three outcomes measured in this study. Before treatment, the patient was asked to rate their pain using the Wong face pain scale. The nurse measured the length and width of the swelling at the sting site. Finally, the patient was asked to mark their rating of the itchiness of the sting using a visual analog scale, where 0 is no itch and 10 is the worst itchiness. The treatment was applied either a hot or cold pack for 15 minutes. After that, the pain, swelling, and itchiness were again measured in the same way as before treatment. Creating exclusion or inclusion criteria limits the source population to conform to the scope of the research question, in this example only adults, and to help assure that good quality data is obtained. For example, someone in an altered mental state or who has dementia due to advanced age may not be able to accurately express the severity of their symptoms in either oral or written form. The sample size was calculated through a power analysis to be 85. A power analysis assures that a sufficient sample size is used in the study so that statistically valid results are obtained. If the sample size is insufficient, then the study is referred to as underpowered, and the conclusions may be suspect, and the study will likely not be publishable. There are study procedures that can help to improve the study quality by minimizing bias. In a double-blind study, neither the test subjects nor the investigators know who is receiving the control and who is receiving the treatment. It is not always possible to blind a study, as was the case in the bee sting study. Once the treatment packet was opened and the hot or cold pack applied to the sting site, it was readily apparent to the patient which treatment they were receiving. Treatments were randomly assigned to patients in blocks of 4. So in the first 4 patients, 2 received heat treatment and 2 received cold treatment in a random order. This process was followed for each subsequent group of 4 patients. This assures that there will be equal number of subjects assigned to the treatment and control. Finally, a study is strengthened if it is conducted at multiple sites. More resources are required to coordinate a study across multiple sites. In the bee sting study, a second site was added in the second year, primarily to achieve the required sample size. The original budget was insufficient to support a multi-site effort. A small grant was obtained in the second year, in part to fund the additional effort needed to coordinate the study over 2 sites.
The length of hospital stay study is an example of an observational study. The research question that was posed is, what are the risk factors associated with a longer maternal length of hospital stay for uncomplicated deliveries in New York State? There was one outcome measured in this study. A woman's length of hospital stay for delivery was classified as longer or not longer. A longer length of stay was defined as a hospital stay greater than or equal to the 90th percentile of all stays stratified by vaginal delivery and C-section. Since a cross-sectional study design was used, multiple exposures can be examined. The following variables were included: body mass index, whether the woman had an ICU stay, maternal age, race and ethnicity, preterm delivery, and maternal comorbidities, such as diabetes or hypertension. Analysis was performed to see which of the variables were associated with having a longer stay. There is a natural source population when researching deliveries: childbearing women. The population was restricted to New York State hospital deliveries as that was what was available from the data. Based on the research question to look at uncomplicated deliveries, an exclusion criteria was used to exclude the complicated deliveries. This resulted in individual level information for all hospital deliveries that occurred in New York State between 2008 and 2013. This type of study allowed for a very large sample of approximately 1.3 million deliveries. Cross-sectional designs often take advantage of large administrative data sources, such as national health surveys, death certificates, or birth certificates. This study used hospital discharge records linked to birth certificates. A snapshot of the population at a specific time allows for conclusions to be drawn across a wide population. This is useful for determining burden of disease and informing resource allocation. This type of study is good for generating hypotheses and provides areas of focus for future research. There are many study designs that provide different information and have different strengths and limitations. Randomized clinical trials are the gold standard for study design and provide the strongest evidence. When designing and reviewing a study, it is important that the available resources are sufficient to achieve the study objectives.